Welcome to 2-Minute Tips from the Child Care Consultation program. Today we're going to be talking about sleep. The average preschooler needs between 10 and 13 hours of sleep per day. That means that if they're getting 2 hours a day in their nap time, they'll be needing 11 hours at night. Which means, again, if your child is waking up at 7 a.m., they need to be asleep by 8 a.m. That can be a tough ask for a lot of parents who are dealing with scheduling and the time that they need to spend with their children in the evening. As much as we can, we want our children to have not only consistent sleep, that means the same sleep every night, including weekends, which we don't want to change so that they have a harder time on Monday, but we want a good quality of sleep, which means they're getting a deep and restful sleep. Some ideas might be to go and look at our children's rooms, to do an inventory, to just take a look at their bed, what it is that they're wearing, what the temperature of the room is, and any other factors that might make it more difficult for them to fall asleep and stay asleep. We also want to be looking to see what our routine is. That means the order in which we do things, which is very important for teaching children, making sure that their pajamas and their toothbrushing and bedtime stories all happen in the same way at the same time in the same place. We also want good rituals that give meaning to children, stuff like telling them stories about their day or praying with them or giving them kisses goodnight. These things are very important to help a child to calm down and to be ready for a good and restful night's sleep. Again, we want to be following a consistent routine as far as the time that a child goes to sleep, which means that we may want to be looking at getting them ready and then watching for cues that they're getting tired. Once we know generally what time a child is getting tired, we can start to move the schedule up or back by 15 minutes at a time, waiting a few weeks once we've changed that time to make sure that the child is getting used to this new schedule and that so are we as parents in a household. Again, a good sleep health routine can make all the difference when it comes to managing mood and behaviors.